Mr. Speaker, today the CBC has been highlighting even more problems in Winnipeg's emergency rooms.
No kidding.
This month marks 14 years that this government has been promising to sort out health care and has not. The problems in emergency rooms have gone on and on and on. This morning, a nurse told CBC that the situation is so bad, I quote, "We leave every shift defeated, day in and day out."
War zone.
Manitobans are at the mercy of this minister's flawed healthcare system, and they have lost confidence in her. I ask the minister when she will admit she has failed and resign.
Yes, thank you, Mr. Speaker. That was cheerful. I would say to the member that we know that nothing is more important to Manitoba families than the safety of their loved ones in an emergency situation. We know that to be true. We care deeply about that, which is, Mr. Speaker, why we support this inquest going forward, and why, Mr. Speaker, that we took many steps in the days, weeks, and months following Mr. Sinclair's death. Certainly, if any individual in our community has additional information that they think will be salient and prudent for the knowledge of everybody at the inquest, then they should take it forward to the Inquest Council. Mr. Speaker, the judge, of course, makes determinations about evidence that's admitted, and I invite any Manitoban that has further information to bring that forward.
Mr. Speaker, the problem is that the emergency room, which is the linchpin of the healthcare system, is not being looked after properly under this minister. She has not been listening to ordinary Manitobans. She has not been listening to nurses in the ER. Indeed, in 7 years, under this minister, and including this year, we've continued to have people dying as a result of waiting too long in emergency rooms. The public's been ignored. As a nurse said this morning, Manitoba emergency rooms, and I quote, are a Brian Sinclair incident awaiting to happen. Still today.
Whoa.
Mr. Speaker, the Minister of Health has not caught many passes lately. I ask the Minister, when will she admit that the problems continue and that it's time for her to resign?
Yes, thank you, Mr. Speaker. The member opposite suggests that I'm not listening, but I listened to him when he said a few weeks ago that our family doctors are the linchpin of the healthcare system, which is why, Mr. Speaker, we have made a commitment to all Manitobans that everyone that wants a family doctor shall have one by 2015. And, Mr. Speaker, by augmenting access to primary care, to work very hard, as the member, as a physician, well knows, very hard on prevention and promotion of good health, we can assist people in avoiding having to go to the emergency room. We know that primary care is a critically important step on the continuum of care for all Manitobans, and we take that very seriously.
Mr. Speaker, whether it's family doctors or whether it's the emergency room, problems continue that should have been sorted out. The CBC reported last week that Manitoba's emergency rooms were so bad that the death of Brian Sinclair could have been predicted, and I might add, should have been prevented. The report notes that there's been one death after another because Manitoba's emergency rooms continue to have major problems. As the CBC story said, and I quote, nurses will continue to be set up to fail. From a lack of hospital beds to chronic staffing shortages to poor morale, the situations in ERs remains unacceptable. I ask the minister, when will she recognize that the problems have not been fixed and resign so that somebody else can take over and do a better job?
Order, please. The member's time has expired.
A moment too soon, Mr. Speaker. I would say to the member very clearly that we know that we want to do all that we can to assist families who are in emergency situations. We can do this by augmenting primary care, by providing access for families to a family doctor. We also know, Mr. Speaker, we can do this by adding additional staff to our emergency rooms. We know that we can do this, Mr. Speaker, by adding alternatives for those individuals that need to seek care after hours, but know that an emergency room isn't the right place to go. And we're doing this with our quick care clinics and after hours for our physicians. But, Mr. Speaker, it is a wonder that the member can stand in his place today and make such criticisms and then vote against every investment that we've put forward in our budgets. Why does he do that?